On this episode of the MedicAlert Matters Podcast, I'm joined by Rob Burley, CEO of MedicAlert UK. We explore his journey into the organization, his background in health and disability charities, and the mission of MedicAlert UK. Rob also shares a moving story how MedicAlert made a real difference in an emergency. And we dive into the Herbert Protocol, an important initiative that supports people living with dementia and their families when every second counts. Enjoy.
MedicAlert Emergency, how may I help you?
I'm the paramedic of BC Ambulance Service. We've run into a patient who has one of the bracelets.
And she's walking, but she's not feeling particularly well, and she showed me her bracelet. So I think we might need a little bit of help.
Did you find her?
Yes, we did.
Oh my God! Oh my God! Thank you!
Rob, welcome to the MedicAlert Matters Podcast. How are you doing today?
I'm good, thanks, Peter, and I'm really pleased to be here. I've listened to the first few episodes that you've recorded, so it's really exciting to have a chance to connect with another MedicAlert and share experiences and our stories with each other. So it's great to be here. Thanks for having me.
Fantastic. And just to let people know, again, you're in the UK, I'm in Canada, so it's the morning for me and it's the afternoon for you. So yes. All right, here we go. So first, Rob, can you tell me a little bit about yourself and what it was about your background in health and disability charities that drew you to MedicAlert?
Yeah, definitely. So I'm always quite embarrassed that I have stayed in the charity sector for so long in the UK because I fell into it completely by accident. So I studied history and politics at university, and I didn't want to be a politician, but I was interested in going into politics in terms of working in that environment. But graduated with no plan and ended up getting a temping job just to get some money on a 3-month contract with a breast cancer charity in the UK. So there's a charity at the time called Breakthrough Breast Cancer. And I had a job that wouldn't exist now because I was typing one database into another. So a sort of job that people I can't believe existed.
Yeah.
That 3-month temping contract turned into a 5-year job because I discovered in that 3 months that charities campaign, they lobby. So my background in the charity sector has been on that side of things, the policy side and the lobbying side. So we call it public affairs in the UK. So trying to influence the legislative agenda and make policies that bring the best for your community. And because I stayed at a breast cancer charity for so long, for 5 years before I moved on, that sort of started my journey in health and disability. So I moved from there to a hearing loss charity. So a charity in the UK that's called RNID, which is the Royal National Institute for Deaf People. And was there for 10 years and developed my campaigning and policy skills sort of further. Then sort of my next substantive role was with a disability charity called Muscular Dystrophy UK. So in the UK, we class just over 60 conditions fall under that umbrella term of muscular dystrophy. So conditions like Duchenne muscular dystrophy, spinal muscular atrophy, conditions like that. And that was my role immediately prior to coming to MedicAlert. So I was there for about 6 years. And that role was my first expansion into a role that covered services as well. So as well as the policy side of things, I led up our support services and our helpline, and I work with health professionals. And it's the role within health and disability where I became most connected to a community of people that I was working on behalf of. So what I really valued about working for that fantastic charity was on a daily basis, I would be speaking to both health professionals and to patients. And what became really clear was if you live with a muscle wasting condition, it's so important that you're far more likely to experience a healthcare emergency. So you're far more likely to have a cardiovascular crisis, or you're more likely to fall and break a limb. And what happens to you in that moment and the knowledge of a health professional who may have no experience of your condition whatsoever, because they're very, very rare, it can be literally life-changing and even life-limiting if something goes wrong in that moment. So I became aware of the importance of educating emergency health professionals and first responders about conditions, particularly rare conditions, in that role. And then when the opportunity came up to join MedicAlert, really connected the dots very quickly, that passion for ensuring someone gets the best health outcomes and my love of building partnerships and networks with people living with conditions, but also health professionals, all combined perfectly to bring me to MedicAlert. So I've been here since January this year, so I'm still calling myself new. But it's been a fantastic journey so far, and really have developed a real passion for the needs of our community in terms of just making sure that not only in an emergency where they get the support they need through their MedicAlert membership, but also just that their MedicAlert membership gives confidence and faith to be going out and doing the things people love, because they know they've got this on their wrist around their neck as a backup.
Well, thanks for that answer. You said a few things there. I just want to touch on a few things before we move on. So you're 8 months in as a CEO of MedicAlert. Wow, look at the contrast. I'm 19 years in at MedicAlert Canada. What a contrast. Another
Yeah.
thing, another thing is you're touching on medical related things like a condition, muscular dystrophy. This word always gets me. You know what I'm saying, right?
Yeah.
But did you have some sort of medical background or training or just personally trying to understand different conditions growing up and even in college or university?
Yeah, no. So if you told me when I was 18, 19 that I would then have a career in health and disability, I wouldn't have taken you seriously, because there was nothing in my background that led to that. And I have no medical training.
Hmm.
I think, like a lot of people, the more I got to know about the health conditions I worked in terms of from a charity work point of view, suddenly realized I had lots of connections back. So I have a family history of high blood pressure and
Yeah.
managing heart conditions. I had a grandparent with dementia. What really fascinated me was how many of us probably have a health condition close to us that we don't even know about. So when I joined Muscular Dystrophy UK, I got this letter from my godmother, and it was a very old, literally a letter, kind of old school,
Yeah.
not an email. And it was talking about how proud she was of that I would join this charity. And I was trying to piece together. And at the end it said, and it means a lot to myself and your uncle, because I call them aunt and uncle.
Hmm.
And I suddenly realized, wow, my godfather has one of the conditions. And I'd just grown up with him becoming less and less mobile and developing a disability. But I hadn't really ever asked, so what's the condition? So to realize that I had that personal connection back to one of the conditions. So he lives with a condition called Charcot-Marie-Tooth disease. So I think the more you explore working in health and disability, the more you realize that actually you're very close to it in different ways. But I think for me, my passion is about sort of social justice and equity. So therefore, having a health condition or an allergy should not be holding you back from doing the things you love, and should not be something you live in fear of. It should be something that society adapts around you for, and MedicAlert plays a key role in helping do that.
Mm. Well said. One thing also you touched on too is, the charity aspect. Tell me if this resonates with you too. When I was younger, I knew a kid that had a MedicAlert bracelet, not knowing what MedicAlert was. Then fast forward, when I was applying to a job in 2006, I seen MedicAlert, and I'm like, I know this organization. I didn't know it was a charity at that time. All I knew is going into my new role in any job I got, I wanted to help people. And that's why MedicAlert was best suited for me. And I noticed in my older years, I'm more caring. Not that I wasn't in the past, but I really care about people. So I wanted to be in a position where I could help people. And MedicAlert was the direction I wanted to go. Does that resonate with you as well?
Oh, massively. I feel hugely privileged that I have fallen into a career that is in a sector where I'm giving back and helping people. And that sounds really twee, but actually what gets me up in the morning is that what I do and what the team here does has real impacts on people's lives and brings real benefit. Something that we're trying to bring in at MedicAlert in the UK is making sure that people realize we're a charity. Because a bit like you just said, actually, when you joined MedicAlert Canada, oh, it's a charity.
Yeah.
I think a lot of people don't realize that we're a charity. So we're trying to really emphasize that what we do is on a charitable basis. We're not for profit. We're looking to increase our reach to people who are more vulnerable and therefore could utilize our service more. But no, absolutely, kind of core to my why is helping people and empathy and being part of a community.
Amazing. All right. Now we kind of touched on what, MedicAlert is, but not in depth. For those in the UK that aren't familiar with MedicAlert, do you think you could describe what MedicAlert is and the services it provides?
Yeah, no, I'll try and do it as succinctly as possible, because I'll try and go for the elevator pitch approach. So I think we've done some real work over the past couple of months here in terms of clarifying what our vision is. So really, MedicAlert exists because we believe that there should be a world where no medical condition or allergy limits a person's confidence, dignity, independence, or safety. So that's basically why we exist. That's our why. Our mission, so our how do we respond to that, is so we provide anyone with a medical condition or allergy with confidence, independence, peace of mind from knowing that their vital medical information can be swiftly accessed in an emergency and in everyday life. And what that means in terms of the what, so what we do, we will hold someone's medical information on a secure system, and we support them through our team of nurses to get that information right, so that in the case of an emergency, someone can use our emergency line, a health professional, first responder, to say, I found someone with one of your IDs. This is their ID number. I've got some basic information on them, but tell me more. So we can quickly say to a first aider, first responder, policeman, paramedic, this person has type 1 diabetes. They're also allergic to penicillin. This is what they kind of can't do. And it's that moment that we give. So we hold your record, and the access to that record is through a medical ID that we provide to you as well. So it's something you wear around your wrist or your watch strap or around your neck, so near a pulse point, essentially. What I'm finding more and more as I talk to more and more of my members is, we fundamentally, we hope that you never use our emergency lines. We hope that there's no reason everyone has to call. But what our members come back to more and more, so we have most people join us for a long period, that they'll stick with us because we give them a sense of confidence and peace of mind. So it's not just preparing for an emergency, it's having that confidence to go out and about, knowing that should something happen, there is something on you that's going to help you.
Yes. Two things. Again, you're making some great points here. And as a longtime employee of MedicAlert, I'm hearing the points and I'm loving it. But you know what? I do a lot of community events now for MedicAlert, right? So I'm talking to a lot of seniors. We go to kids events too, but mostly seniors. And I'm always trying to find the best summarization of MedicAlert and how to explain it. It's like a challenge for me. I love it, to make them understand what we do and what we're about. And you explained everything there. But one thing that we always stress is it goes beyond the bracelet. And I say bracelet, there's tons of IDs, but I'm referring to the ID. It goes beyond the bracelet with the database, because some people really think that we're like the generic IDs that you get online, where it's just the information on the back, but it goes beyond that. Yeah.
Yeah. I think what's fundamental to us, what we really hear from our members here, is that the fact that you can talk to a person about your record. And here in the UK, we have a team of nurses on the staff who can help you update your record. And you're absolutely right. There's only so much that you can say about yourself on the back of a disc that size. For listeners, I'm holding up my fingers.
Right.
But if that disc could be gives you access to a massive record that we can tell a paramedic in detail what's going on, you're right, it's so much more than a bracelet.
Right. And the other thing you touched on too was the longtime subscribers. So another thing that I love when I go out to these events is the subscribers that are so proud of wearing MedicAlert, and they show me their IDs. Sometimes I look into their files and I see they've been a subscriber for 30 years, 40 years, because we've been around for a long time, which leads to my next question. MedicAlert has been around for a long time, starting in the States and then in Canada, 1961. We're going on our 65th anniversary next year. Can you tell me about the MedicAlert UK, who it serves, and the structure behind it?
Yeah, so we're a couple of years behind the Canadian adoption of it. So I think MedicAlert came over to the UK, I think in 1964. And there's a really great organization in the UK called the Lions Club. I think they're international, the Lions Club International.
Yep.
So it was actually the Lions Club that didn't purchase. They brought MedicAlert as a concept over to the UK and really embedded it and set it up here. We're really proud to still have that relationship with the Lions Club, but we're not part of the Lions Club. We're not affiliated to the Lions Club, but we're really proud and grateful for that heritage that we have with them. So we essentially are a bit like Canada, I guess. We're a UK charity, but we're affiliated to the US MedicAlert. So we obviously have the kind of governance and structure there, but essentially we're a UK charity. We have one office in the UK, so we make all our IDs on site here in Buckinghamshire. So for international listeners, we're probably an hour outside of London in kind of the home counties. And We have a small production office here, or production workshop. So we make all the IDs here, and we have our team here. We have about we have 15 staff that do everything, and essentially we work with health professionals. We have a team of people who service the members, so answer member queries. We have we run the emergency line, so 24/7 people can phone the emergency line to get the access they need. So we don't do that in-house. We work with the providers to do that because that's the securest way of doing that. So that's the setup here. And what we're trying to do more of is build on our charitable status and ensure that we're able to deliver programs and secure funding from trusts and foundations, encourage people to understand they can give money to us if they want to as well, and just build those relationships that boost us as a charity as well as provide a service to people.
In Canada, MedicAlert isn't formally recognized by the healthcare system. We focus our efforts on first responders because they're the primary users of our service. But we do, of course, always have conversations with healthcare professionals. In the UK, can you explain how MedicAlert works with the NHS, the National Health Service?
Yeah, no, of course. It's probably more complex than people realize outside the UK, because that word national can be quite confusing, because we do have something called the National Health Service. And living in the UK, we're really privileged to have access to free healthcare at the point of need through the National Health Service, but actually it's not really run as a national body. So the NHS is split into lots of different regional groups and different structures. So here we work with there are hundreds of groups called NHS trusts and groups called independent commissioning bodies, or independent integrated commissioning boards. Sorry. So actually we aren't able to be endorsed or be part of a national NHS. So the national NHS doesn't officially recognise us, but various NHS trusts and part of the NHS do. So a key part of our role is developing partnerships with different parts of the NHS. So some trusts we work more closely with than others. That's based on the relationships we've built, but we're keen to expand that sort of further. But obviously there is national health policy that directs what the NHS does. So we're at a really pivotal moment in the UK in terms of healthcare, particularly in England, because healthcare in the UK has devolved. So England, Scotland and Northern Ireland are sort of run separately as health bodies, and Wales connects in with England a bit more. But we've just had a 10-year plan published by the new government, or the government that's been in place in the UK government that's responsible for healthcare in England. They've now been in place for just over a year, and they've recently published a 10-year health plan, which is really exciting. What at the heart of their health plan is people having more control over their health records and having digital access to healthcare, with a vision of having an NHS app that on the surface of it sounds very similar to what MedicAlert currently does. So a real driver for us is how do we stay relevant within England and within the whole of the UK, and how do we make sure that our service complements what someone should be receiving from the NHS. So it's really important we have that dialogue with health professionals and health policymakers. So we're working really hard to do that. And it's been really great working with the College of Paramedics and other groups who are highlighting how our service will always be that little bit more sophisticated than what the NHS can hold about your data, which has been really great to hear. A real highlight for me in my first few months here, 2 weeks ago, we invited our local Member of Parliament to come and visit the office and see the team and see what we do. He's a first-time Member of Parliament, so he's only a year and a bit into being a Member of Parliament. So he's not yet in government. He's in the governing party, but he's not in government yet. But actually, what the impression he came away with, and he met two of our members as well, was just what an innovative model we have, and how actually the role that we can play in helping advise policymakers who are trying to do what we've been doing for 60 years. So what lessons can we share with them to ensure that people really do have true control over their health data and are able to ensure that the right information about them is given to the right people at the right time?
Mm-hmm. You know what's exciting, and it sounds like you're excited about this too. Moving the needle, very exciting, because we've seen MedicAlert transform over the years. We're practically close in years, when I say years founded, so
Yeah.
61, 64. So it's nice to see the advancement in technology, infrastructure, and that government piece is one of the biggest pieces on our side too, which we're trying to do the work. So I'm glad you shared that with me as well.
I think as well, I don't know how you feel about this in Canada, but when I stepped into the role in January, forefront of my mind was how do we stay technologically relevant. So yeah, what is that next technology piece? And that's really important. But actually, there is always going to be a place and a role for something that stays on your body, something physical. So actually, it's more about how does that physical piece of ID link into a digital health world?
Right.
And one of our trustees is a emergency medicine specialist, so she works in emergency medicine, and she put it very bluntly: the last thing that leaves you in hospital is your jewelry. So therefore, wearing a piece of jewelry or a medical ID still has huge importance, despite the drive of digital healthcare. So it's getting that balance right is going to be really exciting, but also challenging.
Oh, makes sense. Yeah, that's true. That's true. Um, okay, I want to shift gears for a minute, and this is going well. Now, in 2012, MedicAlert here in Canada, we adopted the National Wandering Registry from the RCMP, the Royal Canadian Mounted Police, and we started our Safe and Found program. First, it was called Safely Home, and then we rebranded to Safe and Found most recently, which gives the blue emblem ID. I think you call it a disc. But yeah, the blue emblem ID, which signifies the person has a form of memory loss, something like that. So dementia, Alzheimer's. And the good part of the program is when we changed our back end system, not to only capture demographic information, emergency contacts, physician, most importantly, your medical conditions, we have a behavior management section which captures someone's triggers, de-escalation techniques, and for Alzheimer's, dementia, wandering history, which is very important if someone goes missing. Now, can you tell me about the UK's equivalent? So there's something called the I think it's Herbert Protocol.
Yeah, so one of the things I'm really grateful for is the support of the International MedicAlert sort of community family. So when I joined the organisation, I had a great discussion with Leslie and with Chris in Australia, with Karen in the US, and with Murray's team in New Zealand. So we're really aware that there's a bit more heritage behind the kind of the wandering database in Canada. And I often talk about it here in the UK, referring back to that. So we don't have that national database here in the UK. So the police have never had that. So in the UK, it's called the Herbert Protocol because it's named after a veteran of the D-Day landings who lived in East Anglia, part of England, called George Herbert, and he would regularly go wandering and get confused about where he was. But his local police wanted to work with the family to not stop him doing that, but make sure he was safe. So they developed a protocol which meant they knew if the family reported him missing, they had information about where he might be. Okay. So it's called the Herbert Protocol, named after him. So it was invented by a police force, and a bit like the National Health Service. Actually, in England, across the UK, there are 48 police forces, so it's not just one national body. But that's spread amongst the police community. So where MedicAlert came in was knowing that other MedicAlerts had a Safe and Found program, or were even delivering, as you are, the national database. Actually, what could our systems bring to that? Because up until recently in the UK, the Herbert Protocol was a paper-based system. So you held the form at home, so that if you were reported missing, your family had to find the form, make sure it was up to date. But what we identified was that we could utilize the systems that provide support to a MedicAlert member and store information about someone who might have who has dementia and might be at risk of going wandering. So our motivation was the scale of the problem, I guess, in the UK, and the answer that we had up our sleeve or that we had ready to share. So across the UK, there were just under 1 million people living with dementia. So what we identified was that our solution could be digitizing that paper-based system. So we worked with our local police force, the Thames Valley Police, and developed a system with them that meant we could provide that service. So essentially what that means now is that we, in addition to our MedicAlert normal service, which is a paid for subscription model, for free, anyone living with dementia can store a Herbert Protocol with us. And it's a very simple form. Well, it's actually quite a complex form, but it's a simple process to store your form with us. And we are building partnerships with police forces so that in the event of someone with dementia going missing, it's part of the protocol. So here in our region with the Thames Valley Police, if in a missing persons incident, it's now part of the police protocol that if dementia is suspected to be involved, they will call us on our emergency line to check, do you have a Herbert Protocol, yes or no? If it's a yes, and we have a secure police email address to send it to, we will give them the details of where that person might be found. So we only really launched it fully in May this year. So we've had really high uptake already, but we're looking to accelerate that further and further and work with more and more police forces. What's been really great for us is the partnership opportunity it's opened up to help people with dementia more broadly as well. So you talked about in Canada that the support package around someone living with dementia as well. So for us, it's worked. We're now able to work with charities like the Alzheimer's Society, which is probably the UK's largest dementia and Alzheimer's society, Dementia UK, a charity called Dementia Carers Count, because what we're doing is it's really true charity collaboration. We're not duplicating something they're doing already. We're bringing something new to the table in the dementia world in the UK. So therefore working in partnership with them so that a good example with the Alzheimer's Society is working together to train police forces, not just about the Herbert Protocol, but about how to cope with a distressed family and a distressed individual with dementia. So back to the point you raised at the beginning about that training and that knowledge base. So how do we work in partnership in the UK to build that with other organisations where we don't have that expertise, but what we have is the expertise about storing data and helping build in. What's really interesting in the UK is why are police forces wanting to work with us? And it's really interesting. It's because our system of coming through an emergency phone line for their officers or their staff is really simple. They don't need to log onto an app. They don't need to go into a database. They can just call us and we tell them within seconds whether or not we've got information about this individual. So it's been a real joy launching it this year, and a really exciting challenge ahead to grow it further, get it more and more uptake across police forces across the UK. We're endorsed by something called the National Police Chiefs Council. So again, like I said, there's 48 police forces, so there isn't a central police force. We can't get one agreement in place with one police force that covers the whole of the UK.
Mm-hmm.
But national groups like the National Police Chiefs Council endorsing our approach is really important. And the more success we have with police forces, the more we can kind of grow that model and support more people with dementia.
Are you familiar with our police partnership program, Connect Protect?
Yeah, but don't test me. So maybe just remind me and the UK listeners, that'd be interesting.
Yeah. So in 2015, we started a partnership with police forces. So we have a lot of law enforcement agencies in Canada. So we're not partnered with all the police forces, but that's what our goal is, to be across all of Canada. But the ones that we're partnered with, they have back-end access to our database. So instead of calling the number on the ID, they can call their dispatchers because we train them. We provided training through CPKN, the Canadian Police Knowledge Network. That's where all the police services go for training on various things. So now MedicAlert's a part of that as well. So they learn about MedicAlert, the different colored IDs, because we have the blue ID for dementia, the blue and red for autism, and in general, the look, read, call process to understand about MedicAlert. Yeah. So that police partnership is beautiful because they get to understand MedicAlert deeper than what they probably knew. Because I'm always told by different police officers that I've spoken to over the years, and some of my friends are police officers, family members too, that they do get training on like body worn IDs, but it has to go in depth. So that's what I like about MedicAlert, and knowing the difference between the real MedicAlert and just a piece of jewelry that has diabetes on the back, with no contacts, no phone number, and things like that.
Yeah. So I think we're definitely following in your footsteps on the kind of integration of the back end system. That'd be phenomenal here. That'd be fantastic. Where we are working in a similar way is that training piece. So making sure that we're offering those training materials to paramedics and to police forces that they can recognize and understand what a medical ID is, but more importantly, what MedicAlert is and why it's different to just something that says diabetes on it.
So in Canada, we have our IDEA program, Inclusion, Diversity, Equity, and Action. For people that can't afford MedicAlert, they have barriers. And the real good thing about this is not just based on finance, your financial situation. It's based on social determinants of health. So that can be your culture, your gender, education, and things like that. And of course, your finances play a role in it. What's the equivalent on the UK side?
Yeah, we've got a couple of programs and a couple of different approaches and partnerships that sound similar or trying to reach similar aim, actually. So I think, well, first and foremost, we think we are very affordable here. So I did a bit of Googling earlier and did a conversion. Okay. We cost 17 Canadian cents a day to be a member of MedicAlert UK. So for a start, we don't think cost is we don't want cost to be a barrier. So that's one thing to note. But then we do have programs that offer supported membership or even free membership. So we have a goodwill program, which is in place if someone can't afford the annual membership fee. So we try and make sure we can connect people to that. And a kind of a key role for me leading the charity is to try and make that sustainable. So how can we get donors and corporate bodies and trusted foundations to help us support that? We know that certainly if you're a parent and you're navigating your child having a condition that might mean that MedicAlert can support you, that's a very stressful time already. So you don't want to worry about necessarily have that stress of paying for a MedicAlert membership. So we have something called the Early Start Program, which provides free membership to under 10s. Okay. So making sure that's sustainable as well is really key. So there are two sort of main programs, but we have a number of partnerships going on to your point about other determinants and barriers to access to health, where more and more we're partnering with other health charities where actually or community charities where they see them funding people in their community to have MedicAlert membership as a key way in which they can help people. And it's interesting is more and more conversations are opening up recently. So we recently met with a housing association. So in the UK, there are things called housing associations that provide a range of services, but supported living for people who are vulnerable or need a temporary sort of transition from homelessness into the housing market or being renters themselves. And actually they will often, people in those environments will have multiple health concerns, but also multiple other determinants of health and outcomes. So therefore, for them, it's a social good of theirs and a social mission that can be met by providing MedicAlert membership. So them funding their community's membership through us as well as a model that helps open it up. So yeah, lots of exciting things. And it's an area I think I spoke about earlier where actually we need to utilize our charitable status as MedicAlert UK more to be attracting the funding that means we can do that ourselves. So we really want to be reaching more and more vulnerable people with our support, and doing that in a financially sustainable way is really important. So therefore securing the funding that allows us to do that is a key part of our strategy.
Mm-hmm. Do you find that a lot of, you call them members, we call them subscribers, but even just the general public, do they know that MedicAlert is a charity and they're surprised to hear it? Because that's what we hear on our side a lot.
Yeah, I'm really, in a way, really hard to hear that you have that as well. Because yeah, no, definitely. I think once you join MedicAlert, you probably realise we're a charity quite quickly. And actually, we're hugely grateful to the number of members who donate on top of their subscription. So I'll call them, sorry, help you out. I'll call them subscribers as well. So yeah, so a large proportion of people don't just pay their annual membership fee, they'll give us a donation as well, which is hugely appreciated and really crucial. We'll be running a Christmas appeal for the first time this year as well to really tell the story about MedicAlert, to help members understand what goes on behind the scenes, and kind of potentially if you're a member but you've never used the service, you may not have experience of the value it brings and why as a charity we need support to keep ourselves running as well as taking a membership fee. So providing ways in which people can donate will be really key and motivators for people to donate. But no, in terms of talking to non-members or people who before they become members, definitely, I'd say the majority of people may not realise we're a charity. So again, that's something we're really keen and are on a quite successful journey in terms of making that clearer. And I think the evidence that it's working is that more and more charities are looking to partner with us, because maybe in the past they thought, MedicAlert are coming to us and they're a business, so why would we work with them? But actually, no, hang on, they've got a shared ethos. They're not for profit. They've got a vision and mission that aligns to a social good. They've got a theory of change. They want to make the world better for their group. So let's partner with them. So yeah, there's so much potential in really making sure that people not only know what we do, but they know that we do it on a charitable basis.
Beautiful. So based on what you know now about MedicAlert Canada, what do you see as some of the key similarities and challenges with the MedicAlert UK in the next 5 years?
Yeah, I think this conversation, I think, has just unearthed even more than I realized. So I think and it's possibly the same internationally, not just with Canada. I think it's, a model that's now over 60 years old. How does that stay relevant as society changes, but also how as the approach to health and health management changes? So staying relevant with the way that emergency services are operated, but the way that people have control of their data, that's definitely one challenge. Increasing reach and impact. I think we all across the world as MedicAlerts want to reach more and more people with our support, because we see every day the difference it makes. So trying to really beat that drum and reach more and more people, making the organization, on a basic level, as a charity, making the organization sustainable. So we don't just want to rely on our membership and our subscriber model. Actually, it's like I say, it's developing those programs of funding that mean that people recognize what we're doing as a charity, the impact we're having, and therefore want to support us, even if they don't need to be a member. So I think those are there. And I think aligning with health systems and the direction of health policy and working with health professionals is just absolutely key.
Yeah, I think that's one of the most important at the top. But the red tape, politics to get into government, it's one of the things that we have challenges with here.
Yeah.
I think all countries have it.
Yeah.
Okay, now I need to know if you're excited about anything, any initiatives or programs. One thing I want to just mention, when I was talking to Jonathan, he's a wonderful guy on your end there in marketing, I believe. He mentioned the purple ID that represent epilepsy, I believe.
Yeah.
And we have the blue emblem for Alzheimer's, dementia, and blue and red for autism. Is there any colored IDs that you're working on specific to a condition in the future? Or in general, is there anything exciting that's going on in MedicAlert UK?
Yeah, so in terms of coloured IDs, yeah, they're definitely something we're exploring. So we have that purple one in place already, and it sounds like we should be picking up a conversation after this about your lessons learned, having more colours in place, because I think that'll be really, really key. I'm really excited about. We don't yet in the UK as standard have a QR code on the back of someone's ID, and I don't know if that's true in Canada yet, but in Australia that's been rolled out sort of successfully. I'm excited about how do we modernize the service and keep developing the service so that it stays relevant, not just to people who become members, but to health professionals using it. So I think there'll always be a place for the emergency line, but actually if there was a way to scan someone's ID and get information without the need to pick up the phone, that'd be fantastic. I'm really excited about the partnerships that we started to build this year with not just with charities and other patient organizations, but with health professionals. So that's been a real boost for us this year, and now converting that into reach and impact, I'm really excited about. And I think I've talked a lot about embracing our charitable status, but really building up on that and really growing as a charity with our reach and impact and becoming more sustainable, I think is something I'm really excited about. I'm really, really optimistic about for the future.
Nice. Beautiful. Okay. Now, this next question, I'm going to have to read this one because this is a CEO legacy question. So I asked Leslie McGill, our president and CEO, a question, and I'm going to read, quote, this is what she said, and I'm going to see what you say on your side. It's about leaving a legacy. So what legacy would you like to leave? She said, I'd like my legacy to be that we establish the infrastructure and trust, proving MedicAlert is more than just a bracelet. It is the core part of Canada's health and public safety systems, linking people, data, care at the moment that matters most. Now, UK CEO Robert, let me know, as a CEO, what legacy would you like to leave through your work at MedicAlert?
Why? I mean, you give a real challenge there, because following Leslie's captured it so well. So mine's not going to be as articulate as that. And also, it's fascinating. So as a first-time CEO, 8 months in, thinking about my legacy felt a bit strange this morning when I looked at the questions. But so I'll start from very similar to Leslie's end point. I think is that I would love to leave MedicAlert with MedicAlert embedded in how people manage a health condition or allergy across the UK. Just it being we being seen and being an active part of the health ecosystem. And other parts of my legacy, I would love to have hundreds of partners. So the moment we've got partners in the tens, I want hundreds of partners that recognize the value we bring to their community and are working with us to really increase our reach and impact. I want to be supporting a lot more people. I want to be reaching the hundreds of thousands, not the tens of thousands. And I'd love to have all of that combined to mean that we have a sustainable model that can last for 60 plus more years, so that we're celebrating 120 years, not just 60 years.
Yeah. Beautiful. Rob, that was beautiful. Look.
Well, I think Leslie may have captured it better, but but she's got a bit more experience than I have. So yeah, I'll look back in a few years' time and see if I've got a better answer.
There you go. Okay, now this last question, I'm trying not to get emotional because this is about phone calls, the emergency hotline calls. And there's one that still I thought I got better at it, but just me talking about it, I'm starting to get emotional. So I'm not even mentioning it because sometimes I like to share my um personal stories from people that talk to me about when it worked for them, or I
Mm.
might hear call recordings from our hotline and it brings tears to my eyes. So forget about Peter Lawrence for a minute. Rob, can you share a time when Medical Alert made a difference in an emergency and the personal impact it had on you?
Yeah, so I can't directly share it on myself, but what I can do, the bit of the job I love. Um, so I say this quite carefully. I said to someone that's the team last week. I said earlier, our member of parliament came to visit us last week, and it was great, and he was fantastic, really passionate about what we do. Actually, my favourite part of that day was meeting some members who came along as well. So we had some local members came,
Mhm.
and hearing their story was what really brought home to me. I think that's so important that as a charity, as any charity, you stay close to your community. So I met someone with Ehlers-Danlos syndrome, which is a syndrome. It's a heart condition that essentially means you're quite sort of to fainting, as one of the many other things. So she is a long-term Medical Alert member, and so she not only gave examples of where she had woken up in hospital knowing that her Medical Alert had got her there because a member of the public had seen the bracelet or the first responder seen the bracelet,
Mhm.
but she lived confidently wearing her bracelet, wearing her ID because that's what led her going. Someone else on the day there was someone living with type 1 diabetes who again talked about the confidence every day, but gave a very specific example of when after she'd had her first child, her blood sugar spiked and she was in a car crash as a result. And she knows that the paramedic who first attended, she got the treatment she needed straight away because of her medical ID, and that saved the situation for her. And then just today, Jonathan, you talked about Jonathan. Jonathan met a member this week who'd been at a fair here in the UK, and she lives with a very severe nut allergy. And she touched something with nuts and had an anaphylactic shock. And her medical ID meant that a member of the public got her EpiPen, and without that ID on her, she would not have. She might not be here. It was
Wow.
that serious a reaction. So it's stories like that bring it home, and for me, it's the mix. It's the mix of those powerful moments that you're right are really emotional. That in that moment something happened that saved someone's life or made the outcome far more positive. But also for me, I value the confidence that being a Medical Alert member gives people.
Mm.
That they may never have used the service as an emergency service, but they've lived confidently with it for 10, 15, 20 years because that's what it gives them. It gives them that empowerment and that peace of mind.
Yes. Oh man. Thanks. You got me through it, Rob.
Ah.
Thank you. And that's touching too. Like when you tell those stories too, it's very touching to hear. It's a lifesaver, you know? It's a
Yeah.
lifesaver. Okay. You know what, Rob? This is the last question. Now, this has been an amazing podcast. This is the last question now, and it's a choice, Rob. So
Oh,
you're gonna ask me to read out my left hand or my right hand.
okay. I'm gonna go left hand.
Then. Oh, look at that. It's a personal question.
Ah.
Okay, ready? Outside of work, what's something you're passionate about that might surprise people?
All right. Well, so I'm very passionate about singing, and I sing in choirs, and I'm actually quite good, Peter. So I was in the English schools choir,
Yes.
when I was a lot younger. Now it's just very much the hobby, but I love it. I just love being part of a team. So I'm in a choir of about 110 people, maybe 120. And it's just my local choir. I'll give you a plug, Harpen and Choral Society, always looking for new members. And I just love coming together once a week. I actually love the rehearsals more than the concerts. I love the community of coming together and making sound,
Mhm.
making, we sing really traditional choral music, so beautiful old music. And it's just wonderful sitting down at a first rehearsal and bashing your way through the notes, and then within 12 weeks you're singing this amazing piece, and you play a role in it. So I'm bass baritone, so I sing first bass. So I kind of really love being part of a team and creating something together. And it's just great for mental health as well. So I love the community aspect. I love doing it, and it's just once a week. It's my kind of I ground myself in that 2-hour rehearsal. It's just a fantastic experience.
Amazing. Thanks for sharing that. Oh, that's great. Oh, before we go though, Rob, you touched on something there. I want to know if it's the same in the UK as in Canada. Mental health is a serious thing right now. There's a
Mhm.
lot of people suffering from mental health. We have a big homeless population now. Like there has to be more focus on that. Is UK going through a similar thing?
Yeah, I think it's been a real focus on in terms of national government focus for several years now. I think the language that's sometimes used here is that we've got a mental health epidemic.
Mm,
So more and more people are experiencing mental health issues. More and more people are seeking help, reaching out for help, which is fantastic. But that means there's even more need. So that in the UK, there is a huge demand on mental health services, and huge wait times for mental health services, which is really difficult to hear about, and really getting a lot of national coverage at the moment about the length of time it takes to get someone the support they need. So no, huge aspects. And I think the role we can play as MedicAlert in terms of mental health is just, what shouldn't happen is that living with an allergy or a health condition or a physical health condition shouldn't unnecessarily escalate or cause anxiety and mental health problems. So actually being able to live confidently and know that in an emergency you'll be looked after properly is a real part we can play. Um, unfortunately that we're not able to fix the mental health crisis in the UK in terms of service provision, but we can play a small part at least and kind of really help people live confidently where we can play that part.
mm, right. Thank you. Thank you for sharing that. Um, is there any last words before we go?
No, thank you, Peter. It's been great. I love connecting with people. The more the medical alerts across the world connect with each other and learn from each other, the better. So it's great to have this kind of initiative. But it's just been great. Thank you. It's great to have the space to sit down and talk about where we're at, kind of for the length of time of the podcast. So thank you. It's been a great opportunity, and yeah, really great to connect with you.
Right. Fantastic. All right, Rob, take care and enjoy the rest of your evening.
Thank you. Take care.
All right. Bye. Thank you for tuning in to this episode of the MedicAlert Matters podcast. And thank you to my guest, Rob Burley. Follow us on our social media platforms, Facebook, Instagram, and X. And don't forget to subscribe to the MedicAlert Matters podcast on YouTube, Spotify, Apple Podcasts, so you never miss an episode. Until then, stay informed and stay safe.
Did you find her?
Yes, we did.
Oh my God! Oh my God! Thank you! Thank you! Thank you!
Medical alert emergency. How may I help you?